I think let's get going. So we'll start by introducing ourselves to you all. You're here in case you're lost. Don't be lost. You're in Leading Through Change when it's always changing. I don't know how many of you can relate to that, but I know I can. Diana, why don't you start? Give us a little introduction of, who you are, where you're coming from. And I mean, we work together a lot, so I know Diana, but you all should know her too.
So my name is Diana Campion. I am a nurse, a adult nurse practitioner, and also the education development nurse for IntelyCare. My clinical focus is typically on preventative care, as well as I'm very interested in sleep and mental wellness as it surrounds nurses and nurse practitioners. But I also have a background in ED trauma and medical ICU.
Awesome. Well, I know I love working with you. My name is Rachel West. I am the Director of Education at IntelyCare. I've been a nurse for a long time, started in the ICU, and then quickly realized that actually my passion was in education. And I've spent the last 15-ish years in all different kinds of academic kinds of areas, from pre-licensure, brand new training, through postgraduate, online and on ground, and really truly believe that education is the foundation for everything else that we do. The reason we are all here is because we've somewhere along the way had some education that brought us to nursing. Most of us here, I think most all of us here, are nurses. If you're not, let me know so that we can make sure that we're being inclusive to you. But I want to make sure that you all know that not only do I think education is the foundation for all that we do, I truly, strongly believe that education cannot be one-sided. So as much as I love to deliver content and, share what we know, it's equally important to me that you all know that I want to hear your voice too. So please, if and when you have comments or questions or thoughts throughout this presentation, that you pop those in the question so that we can, the question or chat area, so that we know that we can address those right away. I don't know about you, but I've sat through some really long and hard PowerPoint presentations. And I've also had some really great engaging sessions as well. And it's our intention, Diana's and mine, to make this an engaging, fun, interesting presentation that you can then take back to your workplace, your work environment, and really take and put into action. Because again, I sort of sideline that. I've had lots of times where I've listened to webinars and thought, oh, that was great. Okay, what am I going to do with that now? So while you're hearing and listening to us, be sure to be thinking about how you can put this into your practice as well. We have disclosures. We always have to have those, from our advertised content, that you're going to get one contact hour. We have to give you this disclosure. But the important thing to take off this required slide is that in order to get your contact hours for this talk, you have to go back to the place you registered to and complete the course evaluation. If you get stuck or you run into trouble, please reach out to one of us. Our emails are back on this slide here. We'll put them in the chat as well. It's real easy, just our first letter, last name @IntelyCare.com. We also have to tell you always that we have a learning outcome and objectives, and here they are. You've seen these in the messages that we've sent out to you. So I just want to make sure that you have all of that. That's the business stuff. That's the boring business stuff. Let's start talking about some more interesting things, huh? All right, so this is... Oh, I'm sorry. Please go ahead.
And just to clarify, this will be an hour-long presentation, so we will be awarding one NCPD contact hour at the completion of the requirements.
Right. Great. Awesome. All right. So, this is something I don't have any, you're getting personal information. I don't have any tattoos, but if I did have one, I think it would be this quote. It would be, and I love this little chameleon guy because they really embody what we have to do, what we know we already do as nurses. We are the masters of change, right? Or we hope we are. Our patients, our residents, they're always changing in front of us. Our circumstances are always changing around us. And those who are successful are those who are able to adapt the change, embrace it, and learn how to thrive in it. And some of that is definitely our mindset. Can we go into our workplace knowing that today I have this plan, but probably by 9:30 it's all going to be gone to bits and I've got a whole new plan, right? When I was teaching nursing students way back when, that was my first lesson to them. Look, if you're expecting to have a linear algorithm, you've got your report sheet and you're going to see this person and this person and this person, and you're going to do this and this and this, just go ahead and crumple that up and throw it out because it's not going to work that way. Your patients are going to have a whole different set of requirements. And you know that as nurse leaders, you know that you have a plan, you have a thought, and then someone in a different management sphere maybe says, oh, actually, we're going to be going in this direction. You thought you were going that way, but actually, we need you to go here. So you've been faced with those. We've just all come through a lot of change through the COVID pandemic. Those of you on the front line who experienced that in the bedside areas in your roles, you know this. I don't have to tell you this. I'm acknowledging that you've been through a tremendous amount of change. So that's worth acknowledging. So one of the things that I thought we might be helpful for us to sort of think about when we think about all of the different things that are happening in our environment with new regulations that are changing, in post-acute care, we've got the new documentation rules, we've got new updated MDS, we've got all sorts of things that are happening. We have to have at least a thought to how we can maybe manage some of that change. And if you're not familiar with change management principles, I thought we'd take just a couple of minutes to sort of review some of those basics so that we can then think about how we might embrace the change that's inevitably going to come across our universe. Again, whether we're in a leadership and management position or maybe we're not. So there's a couple of things here. I hope you can see this picture, and I thought it was very descriptive of a change process that can happen. But these principles come from a business leader, and there are four of them, and they are sort of like opposites, opposing ideas. So the select few and the diverse many. What does that mean? That means who's involved in initiating the change. And I bet you can think of, maybe you're in the midst of some change right now. I bet you are, because hello, it's always changing. Who's involved in initiating the change? Do those changes come from top down? Do they come from bottom up? Do they come from the sides? Or maybe does it feel like you're trying to sip from a fire hose? Acknowledging and recognizing where the change is coming from can help you not feel as surprised by it, overwhelmed by it, and blown over by it. So very important to know that. Another piece, when I think about my hat wearing, my role now in the business culture, in the business world, we think about and try to break down the silos of information. Well, I'm in this department and you're in that department. And you know what? In my little corner of the world, and it's a little corner of the world, life isn't working so hot. And I think I need to do all these changes and make all these changes happen. When in reality, there's a whole nother group of people that whatever I might be doing in my little corner is going to affect. So I need to be careful if I'm initiating a change to include lots of different members from lots of different parts of the organization. Here, the second one is a harder one, the have to and want to. I think a lot of times we hope we want to change, but I bet if I asked you all right now how many times you've been involved in some change that really you'd rather not be involved with, everyone's hand would sort of raise, and hopefully you're nodding your head somewhere that you're saying, yeah, okay. Again, knowing whether this is a have to or want to change will help you, if you're leading the change, understand how you can, redesign or reapproach how to handle that. The head and heart, what does that mean? That means there are people that you work with today, you as an individual, me as an individual. I need to have my logical brain satisfied. I need to understand the how, the why, the when, the steps we're going to get there. But I also need to understand the answer to the question of who cares? Like, why does this actually matter? Yay, it's going to save some money, or there's this new rule that's coming out. Well, yes, but why does it matter? And so it's important to understand that some people lean more to the head, some lean more to the heart. And if you're communicating a change and you're making a change, you need to be cognizant of designing a message around both of those things. And then, of course, you need both leadership and management. Leadership and management are two different things. Leadership can and does sometimes come with a title. I am the director. I therefore inherently have some leadership attached to my title. However, there are other people in my department, in my world. When I was a bedside nurse, there were leaders everywhere, whether they had a director or manager or executive vice president in their title, they were leaders. And management, remember, also that speaks to really making those meaningful plans and executing those, the solutions to the change. So those are some principles of change management. So think about, if you can, and I know I've been talking a lot already, but keep thinking about when you've had those experiences of change and what's gone well and what's not gone so great. So change management process, there's lots written about this. I'm not going to spend a tremendous amount of time going through this. You'll have access to these slides and the recording of this in our course shell back where you registered originally. So do take some time to look at them. But there are these 8 steps. The first step in initiating a change is to create a sense of urgency. Well, we get that from Medicare, don't we? You've got to do this, that, and the other thing. So get to it. Well, there's the urgency. We don't have to actually create that urgency. It's being shoved at us, right? Building a coalition, you know what this means, but it's helping build that, those early adopters, those people that are going to support you because they believe in what you're doing, regardless of what you're doing, almost, right? You need those people, and they should be from a cross-functional group. It can't just be in your silo. So if you're making a change, be sure to be thinking about that. Anticipate resistance. Anticipate resistance. I bet I don't have to tell this audience that. I bet you can think of right now people in your organization that are easygoing, ready to take it or leave it, as well as those people that are really question any change, all change, and not just question it, but sometimes actively push against it. So we have to anticipate that and have a plan for how we're going to address that moving forward. All right, then we need to think about our vision, get our volunteers, ask for volunteers. People do want to raise their hand, especially when they feel like they're in a safe environment. And we're going to talk about more of that in a minute. So let people volunteer to help find a job for those who raise their hand, even if they're not necessarily the people you originally thought of as an ally on your team. Bring them in, let them be part in some way, some meaningful way, because your project will move faster. It will go farther if you have those volunteers on hand. So your job as the leader leading any change, again, whether you have this in your title or not, is to anticipate those silos, anticipate poor communication. Show of hands in your mind, and I'm just going to imagine you doing this. How many people feel like their workplace has poor communication? Right? We have lots of systems to try and help, but we really, we don't always, yeah, see, there are the hands. You know what that's like. It's hard. Communication is tough. And effective communication is really tough. And then we feel like, oh boy, yep, now we're over communicating. Wait, hold on, right? So you understand what I'm saying. So poor communication is a barrier to any kind of change. If you can't get people all on the same page, how will you ever help them move together towards a future state? Outsized egos. I won't ask you to raise your hand on this, but ever work with anyone who's got maybe a slightly outsized ego? Those are hard, right? Those are hard. Those are hard to overcome. And then, of course, also inefficient processes. If you're, using an outdated system or a system that doesn't really work, that's going to be a barrier. Those are things we have to address. Always engage and acknowledge, not engage, but acknowledge those small wins. Don't declare victory too soon. I would be careful about that, right? But do definitely acknowledge those small wins. We moved the needle just a little bit. We had slightly increased compliance with a new policy. We saw somebody smile that hasn't smiled in a long time. Whatever those small wins are, acknowledge them and celebrate them. Okay. And then the last step is accelerate that implementation. Use the energy from those small wins to really push your team, keep them going, keep them engaged. And I would say this last thing, this might be tattoo number 2. No, I won't actually, but all organizations face change, but really few achieve their intended outcomes. And that's something to think about. If you're responsible for leading a team of people or you aspire to lead people in the future, do think about that. Start with the end in mind. Be open, of course, to that end being something different than you started with. This doesn't have to be a negative thing. It could be that you learned something new and the way you thought you needed to go actually isn't the way you needed to go. So that's important. So I'm going to switch gears. I'm going to stop talking for a little while. It's going to be Diana's going to talk to us now. And we're going to think about how to really navigate that change effectively and efficiently. Diana, you're muted.
When Rachel and I put together this presentation, I think when we were discussing certain things, there are certain themes that come up over and over again when we talk about how to navigate effectively through change. So before we discuss the actual navigation, let's talk about nurse leadership. The reality is that the only way change comes is when you're ready to lead by example. And I think that is so true. I think many times your team may not be excited or on board with the change, but they will follow you because they trust you. So who is a nurse leader? The answer is as simple and as powerful as we all are. Nurses at every level across settings are positioned to lead. They lead teams, they promote community uh, health with even in post-acute care facilities. They're advocates for patient change and system changes, health policy. So even so, educational institutions and health systems can better prepare and empower new and practicing nurses. We as LPNs, LVNs, RNs, APRNs, directors of nurses, and chief nursing officers, and I would also include in this group CNAs, we all have the ability to be leaders. And as what Rachel said earlier, even though we may not have the title, we still have the qualities to lead. So what does a nurse leader do? So when you mention nurse leader, off the top of people off the top of the hat may think of balancing budgets, scheduling, accessing and promoting high quality nursing care and increasing patient outcomes, and of course, ensuring compliance to state and federal regulations. This is all true, but it's just that tip of the iceberg. So nurse leaders can make a difference in their organization's culture and drive positive changes. Strong nurse leaders navigate constant change in healthcare. They are role models. They set and exemplify the standard for which their team will follow. They cultivate a safe workplace, which is crucial when you have people that you're asking to walk with or follow your direction. They are a source of motivation for not only their staff, but their colleagues. A strong nurse leader will lift morale. We know sometimes, you'll have a nurse come in and right off the bat, the shift's going to be okay just because of their strong leadership style. Nurse leaders are also strong mentors in mentoring their staff. And so this explains why strong nurse leaders improve job satisfaction and retention rates for teams. So, how do nurses lead through change? The answer is strategically. We all are typically under budget, understaffed, and less resources than what we hope. But if we consistently tackle change strategically, whether it's implementing new evidence-based treatments, updates and changes to policies and procedures, or complying to the latest healthcare guidelines, we will become masters of change management. So in the next section, I'm going to discuss different ways in which nurses can lead through change, and especially when things are always changing. So the American Nurses Association recognizes seven leadership styles. These management styles influence patient outcomes, job satisfaction, and staff retention. There are numerous leadership styles to round out your team. And I think that's really interesting. When you're developing and have a team, it's best to have a mix of these different leadership styles so that you can complement each other and also help each other grow. Each type will benefit different roles and situations. So we're going to take a look at these a little bit more closely. So autocratic. So this type of leadership style is authoritarian. Decisions are made very quickly with little input from the team. There's a clear delineation between the leader and the follower. And it's ideal for emergencies. When you're in an emergent situation, many times you need someone to come in and take direction and get things going to get through the emergency, and then follow a different leadership style. Transactional. This is your quid pro quo. They concentrate on efficiency and performance with short-term goals, and it's very helpful with task-oriented and tight deadlines. Democratic leadership style is collaborative, focused on team participation and success, effective with our quality improvement teams. Laissez-faire is detached, laid back, has faith in every facet of the team, works extremely well with experienced or independent staff. So this may not be the best leadership style when you have someone new coming onto the team or mentoring maybe a new nurse. Then we have situational. Situational is adaptive, analyzes situations to determine the best approach based on the need, and it's beneficial for short-term goals such as training. Transformational, which is, I think, extremely popular in nursing, and a lot of where we tend to focus on, because you focus on strengths to achieve the greater vision, and it really complements mentoring, and I find that it's a very nice style of leadership. Then you have your servant leadership, supportive. You address everyone's individual needs, staff development. It's useful for goal-oriented teams and nursing education. So while we naturally may lean towards one or two leadership styles, I think it's a good idea to be familiar with all the different leadership styles and think of it as a tool in your toolbox, because we confront so many different situations, that being able to lean upon one or two different leadership styles to fit the situation can really help you during change management. So it's like a muscle. The more we use the different leadership styles, the more we become comfortable with them and efficient.
So I want to pick up on what you just said because I think it's so important and it's worth repeating and it's worth hanging on to for a minute. So audience team members, this is your moment. If you think about what Diana just said, you're not going to have one or even maybe two of these leadership styles in your toolbox already. But I bet something along the way, as Diana was talking, as I don't know, it did for me, it made me think about people I've worked with when I've had people that were laissez-faire, that were just, okay, go do your thing. I may see you, I may not. And in various points in my career and on various projects, that was okay. And I can imagine moments when that would have been utterly terrifying. And alternatively, the autocratic style. This is how it's going to be, this is where it's going. Personally, my personality doesn't really respond well to that. And that would be important for my leaders to know so that if they have things they need to have me do or do differently, that's something that really makes me kind of bristle, right? So if you think about this, think about, as Diana just said, that these are like muscles. They're tools in your toolbox to understand that there are going to be moments when you've got to straighten up and fly right, and it's got to be autocratic. And yeah, that's going to make some people bristle. You can still make that happen and be mindful at the same time that maybe after that moment or whatever the time frame is, kind of come back and say, I know that seemed like I got to get it done. It's got to be now. We've got to do it. Get this through. And I know that isn't the best way to always handle things, but in the moment, it needed to be that way because we were doing A, B, C, or D. But think about this and think about people you know that you've worked with, that their leadership or some things that they've done really were amazing, that you had the right person in the right moment leading and mentoring you or guiding you or shaping you or molding you to where you needed to go. If you haven't thought about that recently, take some time. I challenge you to take some time and think about that so that you can think about, how am I going to handle this next process? Am I going to think about the people who I have to communicate with about whatever the change might be that needs to happen, or is imminently coming, breathing down my neck, and the train is coming at 100 miles an hour. I better get out of its way. I've got to be able to communicate that and address that with my team in a positive way. So think about that. I'm sorry, Diana. I know I jumped right in there, but go ahead.
No, it's okay. So I was thinking about, let's take a minute to reflect on our own personal experience with leaders. And as Rachel had mentioned, we've all worked for leaders. So what type of leadership style or qualities sat well with you? What didn't? Think about your own leadership styles. And based on your experience, drop in the chat what styles you'd like to be the core of your management practice and which ones you plan on avoiding.
Awesome. Okay. All right. So what type of leader are you? So I'm going to say that I'm an aspirational transformational leader. How about that? Democratic. All right. Yeah, that's good. That's good. Thank you for doing that. Yes. Yeah. Transformational. I think as nurses, we are almost organically trained that way. I mean, if we just bear with me, go back to Patricia Benner's novice to expert model. Maybe you learned about that in school or you came across it in your career, that idea that we start as brand new, we don't know much, and we evolve to this expert person. That took mentoring, that took autocratic. Oh, you remember those nursing professors? You've got to know this, that, and the other thing by this, that, and the other day. We've had those experiences all the way through that, but there's some organicness to the connection between transformational. So we mentor our patients too, right? We wouldn't say to our diabetic patients, "Oh, just do whatever you want."
And I love the fact that there's in the chat group, there's a different mix of different
Yeah,
leadership
I
styles.
love it.
And I think
Yeah,
that also I never really early in my nursing career, I never really realized like you could have a combination
it's
and
true.
how these different combinations suit certain situations. So I thought that was very interesting. So everyone,
Yeah,
thank you for sharing your leadership styles with us. Another way um, to um, to encourage participation is to provide opportunities to influence change when you are in a position to for change management. Even in situations when teams don't have the opportunity to be a part of change, the decision-making process, they can be integral in how the change is rolled out and what it looks like. Rebecca loves speeches because when you hear her talk about natural and how nurses are natural innovators and they're excellent problem solvers, it really made me sit back and say, yeah, we are. I never really thought of it that way, but we truly are. And nurses can identify their sources of stress, provide short-term and long-term solutions. They can prioritize issues that will impact the change or that the change will impact, and be able to be an incredible resource in finding relevant and practical answers. And while doing this, it's increasing staff engagement. So including your team in change at the different levels of change where possible will definitely help you with staff engagement. Promote strong communication. And this is one of those common themes that I talked about before. At the heart of any relationship is communication, and especially in healthcare, where trust is the foundation of our work. So, how do we strong communication increases successful change implementation, whether it's working with patients to achieve health outcomes, introducing staff to new evidence-based practices, or implementing new policies and procedures. Explain the why to the team so they recognize not only the value of the change, but they feel that the change is transparent and that they understand the goal versus just being told this is what's happening just because. I think it's always helpful to start with clear explanations. So in the beginning, this may include team or face-to-face meetings or Zoom meetings, and involve continued opportunities for nurse leaders to meet staff and engage with staff. Characteristics of successful changes in healthcare organizations include healthcare professionals that have the opportunity to influence the change, which we just talked about, but also feel prepared for the change and recognize the value of the change. So once they have the perceived benefit of the change, you can get them locked in. Increase engagement and visibility, once again, through those team meetings and being visible to your team. And I think it's also not only important for nurse managers and DONs, but also higher level leaders to be visible, because when people engage with staff, that helps build trust, that helps build recognition and the ability to allow conversations to happen. And it's also important to answer questions and alleviate team concerns. Communication is a two-way is a two-way street, and so to have to bring about change or to inform people of change, and then to be able to answer their questions and alleviate their concerns. And as Rachel mentioned, you probably already know where the concerns are going to come from and what those concerns are going to be. Can also prep you, but it really makes the team feel valued and heard when you're able to provide those answers. Collect data. Sometimes when we talk about collecting data, it's not our favorite task to do, but it's important. And this is why it's important to embed data collection throughout any change management process. So before you take any action, you want to record the current situation so that you can then measure the impact of the change. And it doesn't have to be complicated. For example, if you're implementing a new infection control practice, you can count the number of infections per day or by shift on a spreadsheet and keep track that way. Based on the scenario, use a tool that works best for your team. In addition, I think it's a great idea to survey your team so that you can also when you're analyzing your results, you can also take a look from a team perspective: what worked, what didn't work, how can this be improved, how can we improve the process the next time around when we approach change management. This way you're not constantly recreating the wheel. Also, data can later be utilized in a host of different ways. And I think, wow, when a lot of times when as leaders, we talk about needing change, especially when approaching upper management, one of the things that we need to show is evidence. So when we do these changes and we have this data, we can use that to our advantage to advocate for the changes that you need in your department or your unit or your facility, because data talks and management and leadership listens to data. Um, my next bit of advice is to be realistic. Um, like life, change can be messy. Doesn't necessarily work out the way we hoped in that nice linear way that may have been projected or even presented to us. So I think it's very healthy for our own mental health and wellness to reconcile that everything's not going to go according to plan or may work out as anticipated, and that we need to be prepared to pivot, and or things need to be redefined or reprioritized. And if I think we accept that that's just a natural process of change management, I think that keeps us having a fresh perspective and being able to adapt to it better versus it feeling like it's just something being added on to us. So having realistic expectations and being able to respond to changes in a healthy way fosters that positive relationship with change, not only for your team, but for your team as well. Because if when things do happen, they will naturally be looking for you for leadership. Seek support. I love this quote by Steve Jobs. I think it applies to nursing and to healthcare. Great things in businesses are never done by one person. They're done by a team of people. And I would encourage you to quickly identify your work resources, your work partners, whether it be management, education department staff, unit champions, even some facilities have patient advisory boards, but really utilize the work resources that you have at hand. You cannot do all the steps of the change process yourself. So include as many people as you can and as is applicable. Work colleagues, network with fellow managers and as well as professional networks like LinkedIn and professional organizations. While they may not be able to help you with your specific change that's taking place, these are resources that you can utilize to learn more about change management or how change management works in different facilities or at different levels of nursing. And I think that helps us to widen our lens at the different possibilities. And then also, in turn, you can also provide that support back. I also think at every level of nursing, it's incredibly important to have mentors, and they can be valuable resources of support and someone that can also help you grow and over time, because the leader that you are today is different from the leader that you first started when you were nursing and is different than who you're going to be 6 months from now. So, and they can help you navigate through that as well. So I'm going to hand the presentation back over to Rachel. Rachel, I think you're on mute.
Just kidding. So before we get started, are you a mentor? Do you have a mentor? I'd love to know. Not, I don't need their names or anything like that, but yeah, I mean, it's just, yeah. So looking for a mentor, and they come from sometimes unexpected places. I know I have asked the universe for a mentor myself, and then I realized that I actually had one, and didn't realize it in some friendships that I have outside of my work environment. And those people, while they're not in my exact lane, they're close, right? So definitely LinkedIn is the place to go. If you're not there, get there. And those of you that are, it is such an amazing feeling, isn't it, to be able to be there to help support others as they go on. I'm mindful of our time, so I'm not going to speak any faster than I absolutely have to, but know that both Diana and I are here to help you, to support you, maybe be your mentor, maybe help you find your mentor, or maybe be mentored by you. So definitely, yeah. All right. So leadership isn't being in charge. We know that it's about taking care of those in your charge. If you're not familiar with Simon Sinek, definitely check him out. We definitely need to make sure we're building resilient teams and maintaining that healthy work environment. And I say that with the giant caveat and grain of salt that it's so hard to ask people to be resilient when they are facing what is happening at the bedside today with short staffing, feeling underpaid, feeling and being underpaid, feeling and being physically, at risk from violence between other staff members or from patients or family members or things like that. I know that what we're talking about here is not automatically achievable, but I think it's important. The reason that we included this is that we need to continue to maintain whatever shreds we have so that we can be there for ourselves, so that we can be there for others. That saying of you can't pour from an empty cup. We have to be taking care of ourselves, be taking care of our team members, our family members, so that we can take care of those who need us most. So, all right. So, we need to think about, I love this picture. This is such a fabulous image. A lot of times when I'm talking to and educating, we're thinking about a foundation. This is it. You got to have a safe environment where people feel like they can trust you as the leader, who feel like they can come to you with their concerns or problems. You're going to hear them and you're going to be able to do something with them, if only to validate that they are having that concern or issue. There are some other things here as well. So prioritizing safety. Diana, why don't you give us a rundown on this? Oh, yep. Go ahead. Well, hold on. Unmute.
When we look at the traits that we want our nurse leaders to have and to demonstrate, such as problem solving, implementation of ideas, fulfilling their potential, and rising to the moments. If you notice, these fall under Maslow's hierarchy of needs for self-actualization. And these are traits that you really need in place in order to adapt to change in a healthy way. But take a look where safety is. That is a huge leap. If you have an environment where nurses don't feel safe, a huge leap to self-actualization where they can be working at their best capacity, but also dealing with stress and change in a healthy fashion. So how can we create a safe environment for our nurses? The American Nurses Association has developed a nurses bill of rights. It is not legislation, but it really is a guideline for leaders to draft facility policies and procedures. And there's specific tenets that they speak to regarding promoting respect, inclusivity, diversity, and quality. Every nurse has the right to be seen, but also feel comfortable in their environment. A safe environments, work environments include honoring ethical nursing practice standards and code of ethics. Also providing the freedom for nurses to advocate for their patients and raise legitimate concerns about their own personal safety without fear, making sure that there is no sense of retaliation within the workplace environment when concerns are brought up, and also to have strong policies in place. This is not one of the tenets, but to have strong policies in place that does not tolerate incivility, bullying, or workplace violence, whether it be lateral between coworkers or patient or visitors on healthcare staff. And when these policies are created and developed or updated, to make sure that they are enforced, because then everyone on the team knows where the company health organization leadership stands, and we're united towards this.
I think we've all. Go ahead, Diana. I'm sorry.
No, go ahead. I'm sorry.
No, go ahead.
No, I'm good.
Okay. So I think, providing resources, we've all heard, okay, we'll just call the EAP, or, maybe you've seen some memes out there that, yoga and meditation is not going to solve the healthcare crisis. That's true. However, it's not going to solve the structural challenges that healthcare today has, that post-acute care nurses experience every day. That's all very true. But as individuals and as leaders and advocates for our patients' safety and well-being, we also have to be advocates for our own. So it's important for us to really model the behavior that we hope that our coworkers, our teammates, our patients and residents will have in their own world. Recognizing and articulating that, I'm mentally fried today and there's really nothing more I can do. I need to take a break, and really modeling that and showing the healthy way to say the stress is beyond what I can handle right now. This is the two or three things I really need help with. And I need to just step back, take a mental moment, zone out, do whatever it is, will go a long way to helping change some of the compounding stress and challenge that our teammates are experiencing every day, that you're experiencing every day. I don't have to say that to you all, because you certainly are. We do have, I don't know if is anyone familiar with, you ever heard of this idea of restorative breaks? We all are familiar with, well, I get my 30-minute lunch or my 15-minute this, that, or the other thing. If you've not heard of restorative breaks, I strongly recommend you do a little dive into the universe out there on what a restorative break is. The idea is that you're on break, like break. 100 years ago, when I was a brand new nurse, I did a 5-minute stint at a children's ICU. I thought I wanted to work with kids. It turns out I didn't. That's not important. But it changed my life in this way. I remember walking into the unit. I was ready. I took my assignment. And then one of my coworkers walked by and said, "Are you having A or B lunch today?" And I was like, "What are you talking about?" I'd worked in adult ICU for a long time. And I was like, "Well, you don't get a break. You don't get a lunch. That's hysterical. What do you mean you get A or B lunch? What are you talking about?" And she said, at the beginning of the day, we all decide collectively, all the nurses and ancillary team members decide, are you A lunch or B lunch? And no matter what is going on, we all know that you're leaving the floor, you're taking off, you're gone for these 30 minutes, and we'll cover you. Like, we've got your back. And I thought, what an amazing team culture that particular unit had to, at the front of the day, organize your day, plan for the fact that during those 30 minutes, you're going to be watching someone else's kiddos and they're going to be watching yours. Now, of course, emergencies happen and crazy stuff happens, but to have that intention of a true restorative break where I am off the unit, it's the expectation of everybody that you are gone. That really does help. It improves your alertness, your time management. I knew I had to have my ducks in a row before 11:30 because someone was going to come in and take over for me. You know what I mean? So it's a terrific idea. If you're not familiar with it, please do check it out. I think we can do better. We can do better with that. All right.
So again, back to communication, because it seems to it's one of those pillars. Adopt and maintain an open door policy. It encourages employees to discuss their work-related ideas, opinions, concerns, and feedback with their manager, again, without fear of retaliation or reprisal. So here's some tips on how to do that. Be approachable and be ready to listen. Now, a lot of times, sometimes we've been part of organizations where they've stated that an open door policy is in effect. However, based off of a leader's demeanor, affect, they're really conveying something differently with their nonverbal cues. So make sure that you're approachable, ready to listen. I had a nurse manager that whenever she came onto the unit for the day, she would walk the floor and just check in with every single staff member to see how they're doing. And if there was a concern or an issue or an idea that they wanted to talk about, she would set a time that worked for them both. And that leads into reaching out, being visible, whether it be through, if you're dealing with multiple shifts, offer 1 or 2 Zoom meetings a month, or staff can come in and ask anything. Don't have an agenda. They can come in and ask. That's a way to deal with that while you're still maintaining your own health and wellness and your own personal type management. Set boundaries. While we want everyone to feel safe in discussing ideas or concerns, we also want to make sure that it's not getting too personal, or it's not a gossip or 1 hour complaint section. We always have to kind of revert it back to the issue at hand. Next is follow through. If someone is vulnerable or takes the time to bring an idea or has the courage to address a concern, make sure that if you're not able to conclude that on your one-on-one, to follow back with them. And some issues can be resolved in a quick 10-minute session. Sometimes it's multiple meetings to work out, and that's okay. But just make sure that you're able to follow through, because that's a horrible feeling if you bring up a concern to someone and they don't respond. Next is to lead with kindness. And I think that is an inherent part of nursing, and it lends well to our profession, but confronting change or discussing change or issues or concerns is never comfortable, and recognize and respect the fact that someone is coming to you out of vulnerability or courage.
So I'm just mindful of our time, and I want to make sure that everyone, before you, if you have a hard stop at 3 o'clock, this recording will be available on the course shell. I put the web address in the chat. It's the same place you went to register for this for today. Do complete the course evaluation. After that evaluation is completed, you will then get the certificate will be emailed to you. Check your junk mail because sometimes it gets sent there incorrectly. And again, this recording will be there within 24 hours. Feel free to share it. We'd love to have as many people as possible experience this, but we're going to keep talking so that we have the full recording for you. Okay. So thanks again, everybody, for coming. If you have to drop, we understand. If not, we're going to finish up. We only have three more slides to go through. Okay.
Oh, you had control. Sorry.
Oh, sorry.
Okay. So I want to, on the other side of the door of the open door policy, the reason why communication and having an open door policy is so important is that it enhances the communication throughout your entire staff. It increases job satisfaction and retention because people feel valued, they feel heard. It boosts morale, and it also promotes enhanced problem solving. If I go to Rachel with an idea and we have an open conversation about it, and whether or not I get the answer that I had hoped for, if the process was a positive process, I will be more encouraged to go back with more ideas or share opinions. And then also it improves efficiency and productivity.
All right. So recognizing your team, we understand, there was a moment, and it was a moment, right? And maybe that moment was only this big for some of us, and some of it was wider. It doesn't matter. That doesn't matter so much. But there was a moment when people were calling healthcare workers heroes, and maybe that resonated for you, and that's great. But for many people, it didn't resonate. So it was a well-intentioned recognition of the truly heroic work that was happening during COVID, that I argue is still happening today in many senses. The work that happens as nurses, as nursing professionals, as clinicians in healthcare, wherever you are in the world. For Libya, wow. I think that the work we do is really very powerful, and it's often for so many of us hard to hear that recognition. So as a leader, whether formal or informal, recognizing that it's hard to take positive feedback, almost as hard sometimes as taking negative feedback, I would argue. We still have to recognize the accomplishments of our teammates. We still have to recognize and respond to those. So thanks and appreciation. I don't know about you all, but I love getting mail. No, mail, not email. I get too many of those. You can keep email all day long, but a handwritten note, a card, something somebody took the time to write out to me is so valuable. I actually keep a file folder from when I was teaching of those handwritten notes that students would write to me sometimes. It cheers my day. I hope you all have a happiness folder somewhere. Encourage your team to hold on to those as well. It really, when you can recognize somebody for something good that they have done, it is a very powerful thing, and helps keep people motivated to keep going. All right, so what are you taking back to work with you? What are you taking back to work with you today? We've been talking for about an hour now. I want you to think about at least one thing that you're going to take back. with you, and either pop it in the chat, send us an email. Let's connect on LinkedIn. I'm happy to connect with you. And really, I've loved this. I've loved every minute of it. Thank you all for being here. If you have any feedback or questions that you want us to address right now, we're happy to do that. But otherwise, please do feel free to reach out to us. Hope. Oh, I love that. Thank you. I love that. We have hope. I love it. You'll also have you'll have all our reference slides. We spent a lot of time building lots of references for you for today. But again, we really thank you so much. Have a wonderful rest of your day, everyone. Be safe. Be safe out there. Take care.